Hello, today I'm going to talk about plantar fasciitis and the way we look at issues that get labelled as plantar fasciitis. So plantar on your foot, this is the sole of your foot, which is called the plantar surface, and this is the top of your foot called the dorsal surface. So plantar, anything, means it's on the sole of. Fascia is a kind of tissue if you looked at meat, it's like mother of pearl in appearance. It does not stretch, okay? And the plantar fascia attaches to these bones here, which is where the ball of your foot starts. So the ball of your foot would be running across here between these two fingers here, like that. So basically where these toes are is where you bend at the end, but your plantar fascia attaches here, 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 here and here, and it runs to the front of your heel bone, but it doesn't stop there, okay? So the muscles in our body are not separate the way they're shown on an anatomy chart in quite that way at all. And I've done dissections, so I know. So basically all of these tendons pull here and they pull to this heel here. So basically we should have an arch on our foot, and that pulls, this then is sitting across here, and it acts as a spring for our foot. But sometimes people have collapsed their foot in. This is how we would see it. So they've collapsed their foot in so that they don't have an arch anymore. And you can see there it's kind of flattened. And the stress that they're putting on this plantar fascia that runs from here out triangularly attached to all of these is enormous. And it can happen because people are, instead of walking correctly and so on, they're turning their foot in. Maybe they cross their legs so their feet are like that, and then when they're walking inwards. There's lots and lots of different reasons, but as soon as you wear an arch support here, you are propping all this up and you are allowing the muscles under here to weaken, okay, so that they are no longer strong enough to hold your foot up. So you've got that layer on top of that. So basically your spring ligament is a ligament in about this position here on your foot, and you can feel for it. You can feel this bony ridge of this big toe along, and then here you will find potentially when you've got plantar fasciitis symptoms, you will find that if you saw away on there with your own finger or with a knuckle, just do it for 20 seconds, come back, it should be less painful, less painful, less painful, and it helps your foot to spring back up into its flexible point. It won't deal with it if there are other issues on this line, because your foot is on the end of a line here, and it can have gone tight anywhere up this back line. So if people are like this and their neck is up and tight, they may feel the symptoms in their plantar fascia because of the fact that they're stretching further up the line, and it's pulling them and it's coming from under the feet, the same as hamstrings might be, in inverted commas, tight. Whereas there's a lot of evidence now that the hamstring isn't tight, it's just somewhere on that back is tight, and it might be the calves, it might present here in the hamstrings, or it might present under here. Plantar fasciitis, forget the itis. The British Medical Journal, and I would agree, and lots of other people I know would agree, it's not an inflammatory process. It is a tissue that's being overly stretched, and it can't bounce as it should when we're walking, okay? So there's exercises we can give people. We might work directly on here. So if I show you this foot briefly, so that you can see where the plantar fascia is, it's running here from the base of the toes, and it's running to the calcaneus, but as you can see here, it runs under, and it goes under the heel bone and up into the Achilles in a continuous line. There's the heel bone, it runs across here, under the heel bone, and up in a continuous line up into the Achilles that merges into soleus and your gastrocnemius, your calf muscles, and so on. But forget the itis. Plantar means sole of your foot. Fascia is a set of tissue. There's something the matter with some soft tissue on the sole of your foot. We work with you to try and help that to get happier. Okay.